Hey guys, Sudarshan PT, thebodymech.com. Welcome to my channel. I'm here to explain you about the current situation, which is COVID-19. As we all know that respiratory system is the main system which is affected for the most. And this virus tends to weaken the respiratory system as the disease progresses. I have certain set of exercises which will strengthen your respiratory system, make it stronger to fight against the virus. I believe in this theory because, as we saw, most of the athletes and fit celebrities who were positive and came out with negative results after quarantining themselves. That is all because of their fitness level and stronger respiratory system. Fine. So I feel like this exercise will help us to fight against the virus along with the medicine. I would prescribe these exercises for certain group of people, like people who are not yet positive for COVID-19, like healthy individuals, maybe who are COVID-19 survivors who came out of COVID-19 and who has minor symptoms and quarantined themselves. Okay, for these three group of people, I would like to prescribe these exercises. So before coming to the exercises, let's see what is this COVID-19 in a simple way. So let's see what is COVID-19. COVID-19 is a viral borne disease which is infectious and contagious in nature, transmitted through infected droplets while coughing, sneezing, or talking. And this is caused by severe acute respiratory syndrome COVID virus 2. Fine. And this virus was first seen in China in the year of 2003 with cat. So cats were infected first. And in 2012, it was seen in Saudi Arabia in camels, and it was named, that virus was named as Mid East Respiratory Syndrome COVID virus. Fine. So these are the two strains of COVID viruses. So the onset of this disease is 2 to 5 days after infection, typically 5 days, and the duration of this disease is 5 to 10 plus months. So this disease can stay up to 10 plus months. So coming to the symptoms of this disease, we have common symptoms, less common symptoms, and severe symptoms. Common symptoms are like fever, dry cough, and tiredness. Less common symptoms are like pain and ache, pain and aches, diarrhea, uh, loss of taste and smell, loss of taste and smell, headache, and we have a discolorization of fingers and toes, rashes in the skin. So these are the less common symptoms. Stomach pain have come recently. It alternatively leads to diarrhea. And coming to the severe symptoms, you have dyspnea, which is shortness of breathing. Dyspnea. You have respiratory muscle fatigue. weakness of respiratory muscles, kidney failure, respiratory failure, loss of speech and movement, I have chest pain and pressure, hypoxia, low oxygen concentration level in the blood. So these are the symptoms of COVID-19. Let's see how it is diagnosed. Firstly, it is diagnosed by signs and symptoms and real-time reverse transcription, polymerase chain reaction testing, nucleic acid test of infected secretion, coding, pathological finding, at autopsy. So these are the diagnostic procedures. Now, who are at more risk? Most risk, most risky individuals. First one is who works with animals, live animal marketing workers. Live animal marketing workers, because as we see this virus is derived from the animal source. Patients with pre-existing cardiorespiratory diseases. Low immunity, people with low immunity, healthcare workers. Of course, if you come in contact with the infected person, you will also get it. So don't neglect this COVID-19 because this can lead to severe complications. So the complications of COVID-19 are: first one is pneumonia, viral sepsis, pulmonary fibrosis, kidney failure, respiratory failure, and chronic COVID syndrome, cytokine release syndrome, have pediatric multi-system pediatric multi-system inflammatory syndrome. So as you can see, these are the complications of COVID-19. COVID-19 can lead to these many diseases. So COVID-19 is not funny. Don't take it as a funnier way. It is a serious condition which is leading to destruction. Science is finding difficult to find a cure for this disease. One or the other day it will happen. Okay, so wear face mask, sanitize your hand, keep social distancing, don't go out, stay home, and strengthen your respiratory system. So this COVID-19 has no particular treatment. Till then, we have to take care of ourselves by preventing it. We have certain preventive measurements. You need to follow it. Right?